This video is titled How to Satisfy or Exclude Health Reminders in Intergy EHR. In this video, we're going to provide a list of functionalities that satisfy and exclude health reminders. We will also discuss examples of where to document in Intergy EHR and also how to utilize the HCN Quality Measures form. There are various Intergy events that satisfy a health reminder, or even exclude the patient from one. For example, documenting either in the encounter note or the problem list that a patient is pregnant can trigger the chlamydia screening, and at the same time exclude the patient from the BMI screening. Although scanned reports are highly recommended and in some cases required, please be reminded that PA dashboards will not count the image for the compliance. Therefore, the health reminder will not be satisfied for this action. It is important to update the patient's problem list during each visit in order to trigger or exclude a patient from a reminder. You can utilize the HCN Quality Measures form to document an exclusion or diagnoses. Once a diagnosis is selected, you are able to right-click over it from within the note and choose the option Copy to Problem. Documenting the patient's medical history can also satisfy or exclude them from a reminder. The HCN Quality Measures form can assist you to capture this information. For example, you can either enter the date the pap smear was performed to satisfy the reminder, or enter the date the patient had a hysterectomy to exclude them from this reminder. Please be reminded that the onset date is the date the procedure was completed, not the date it was reported. Entering the incorrect date will affect when the reminder will appear again in this patient's chart. You can also use the HCN Quality Measures form to identify the procedure codes documented in the visit. Findings that will drop a procedure code or CPT code in orders and charges are identified in the label description. Upon completion of the encounter note, you will proceed to Orders and Charges, where you will select the Charges tab and make sure to select the Encounter Note radio button. This will provide you a list of codes entered in the encounter note. If they are all related to one diagnosis, select the diagnosis to which the charges will be billed with, and then click Select All. If you need to separate the charges to multiple diagnoses, highlight the diagnosis and then click on each line item. Don't forget to sieve. There are other daily functionalities that need to take place in order to satisfy or exclude reminders. Some of these are prescribing or entering reported medications in a patient's chart, and also recording vitals during every visit. In addition, receiving or entering manual labs results. Thank you for watching our fourth video on health management reminders. Please be sure to watch our video number 5 on generating a clinical alert report.